Hello, family, friends, and any listeners out there. This is going to be my first attempt at doing a YouTube channel covering specifically my fight with leukemia the last 13 months. I'm going to cover pretty much everything chronologically. Maybe sometimes I'll drift out of the date, uh, but just wanted to kind of do a preview video, and kind of put things together. And basically, let's see, it was July 5th of 2023, right after the July 4th celebration, which is usually pretty big in Huntington Beach, California, with all the fireworks. Wasn't feeling too good. Thought I had the flu for the last week. Had even done like a 100-mile road bike ride 3 weeks earlier. Felt a little weak, but it came on really fast. I have A.L.L. leukemia, pretty aggressive, and blood cancer. So July 5th, went to the ER. Then basically a day and a half later, July 6th, 7th, I was diagnosed with the leukemia with my wife by my side, and the Fountain Valley Memorial Hospital. Spent probably the next 8, 9 days there while they stabilized me with hemoglobin transplant, platelet transplant, magnesium transplant, potassium, you name it. They were just trying to keep me alive. And it was a little scary at first because when I went in, I was basically up sepsis and had below 5 platelets, unmeasurable. So blood was starting to come through my skin, in the form of petechiae. Um, so the next few days were kind of tough emotionally, physically. Um, but getting into the room at Fountain Valley Memorial and then seeing what the diagnosis truly was and the treatment options, and picking the hospital where I wanted to be treated. So ended up being able to get into UCI Orange, very well-known local Orange County hospital for treating it, instead of going far away like MD Anderson, Houston, or even up north a little further, UCLA, USC, or City of Hope, Downey, up to 605, which is probably about a 40-minute drive. So, but if I was going to go through treatment, I wanted it to be a little closer to home and easier for family to come back and forth, because their support for me is what has gotten me through all the different stages that I've had to deal with. So, like I said, I'll stick to chronological. My wife was extremely good at documenting everything. I have an extremely large binder. Everything's chronological. So as I break up the videos by time frames and certain different treatments, including first round of chemo all the way to uh, that lasted the treatment. I was in the hospital at UCI Orange for 5 weeks after Fountain Valley. Um, so it was quite a long stay. And, after I got out of there for the first 5 weeks, became outpatient. Then the next round of chemo started in 3 weeks. So every time there was an outpatient for 3 or 4 weeks, when I went back in, it would be about 7 weeks in there for the next round, dealing with the chemo and them babysitting me, so to speak, with blood work every 3 hours, even at 2 a.m. in the morning, 4 a.m., 5 a.m., however the timeline worked out. But basically, I got used to it. I had a PICC line installed, so as if anyone's familiar with those, right now I have one in my right arm, so it basically runs in my brachial artery into my heart. So I got used to being able to sleep while they were doing blood draws out of those. So I laugh, but sometimes you're just completely out of it. So, but once I got in and out, I had to say the first time getting out after 5 weeks in, I was I could barely walk. So uh, going to the clinic at the Chow Center across the street that takes care of the outpatient while you're doing that at UCI Orange, um, it was tough getting there, getting out of the parking structure, getting to the ATC unit that takes care of transplant patients, and blood work and tests, and do I need anything transfused, things of that nature. So it was a challenge, to say the least. It did start getting better. Um, After the second round of chemo, the doctor did say that most of the leukemia was gone, but it was still detectable, and it needs to be zero. So the idea was we move into the transplant, stem cell transplant, uh, but that preparation takes a long time, like 5 months sometimes. That's what it kind of took. So I had to continue on with the other rounds of chemo, and then obviously had to get a donor, track down a donor. I was very fortunate that my son was a match, at least 50%, because he's 50% of me. But the genetic 50% was preferable. And him being 16 and being a minor, it was tough to ask him. But he was pretty, almost didn't care. Like, he was like, "Oh, of course." So he was, and his name's Tate. And so it went pretty well. Like I said, it actually happened on the 21st of December, 2023. And I was actually out January 6th. So it was even the nurses were a little surprised. So it went well, and my body took it well, even with the chemo that I had to have for the transplant before. Was a bit brutal. It was the strongest I'd ever had, because they had to wipe out all of my stem cells to make sure that uh, they don't fight the incoming stem cells as like it was a cold or a flu or a virus, like it goes after it as a foreign body. And then, of course, the 1 day of radiation, which is the only radiation I've had. And I, after the chemo, 4 days of chemo, 1 day of radiation, then the stem cell transplant on December 21st, then 2 more days of chemo. I was pretty tired. And of course, it was during the holidays, and I was secluded in a double door. Nobody could come visit me. But you know, Zoom became your friend. This whole process, the technology was really kept me sane, and having my own computer in my very relatively large room, double door, of course, um, was was good. Still managed to keep up with my work. Uh, my incredible business partner, David Craig, was taking care of everything in the office, and I was still trying to make sure that operationally everything was taken care of, bills paid, dealing with attorneys, state, federal, pretty much operational stuff, paying the factories, doing wires, entering bills. I mean, honestly, there were times I was struggling where I couldn't see. So I had to have 3 different types of reading glasses strengths, just as my eyes got better, then they'd get worse to get better. And then also taking a specific drug, medicine. It's called tacrolimus. It helps fight the host versus graft disease, meaning if my body is fighting the new stem cells from a cellular and or organ, kidneys, liver, everything. But there's some side effects that come along with that that really affected me a lot. tremors, hand shaking so bad I had to learn to type with just 2 fingers, which was kind of ridiculous. But if I tried typing normally, my outside fingers would just constantly hit other keys, and it became very frustrating, especially like if I was doing school, which I took 2 months off of school, July to September of 2023, but I was right back in there. So I didn't want to give up on it. I was too far along to finish up a degree, specifically for business operations. So it only helps me and uh, run, my company better, along with my partner. So, uh, and of course, dealing with family, still trying to stay involved. At the time, 16-year-old twins, boy, girl, uh, now 17. Uh, just is pretty important time in their life and important to me. So, so I will, as I backtrack and start putting out smaller sections of the videos that are smaller timelines and talking a little bit more about what I what happened, what they did in the treatment, how I dealt with it, um, and pretty much, you know, I'm going to keep it very informal, but just know that I'm not a doctor, but I've learned a lot along the way. You kind of have to. But the discussion about what the treatment was and how it affected me and how my body dealt with it, and maybe why my body dealt with certain things better than other. It's from an experience, not a doctor, prescribing something or telling you to do something, but it's, you know, people can relate. They will relate to it if they've ever had to fight leukemia or really any type of cancer. It's, a lot of the treatments are similar. The medicine and the meds that you have to take after certain treatments are the same. But just know that chemo affects everyone differently. Um, and it doesn't even mean that just because you're young and strong that it's not going to affect you worse. Because let's be honest, when I got diagnosed, I was 54. I'm 55 now, and there was only one time that I ever threw up, ever, and it was uh, during the first round on the second day. There was this particular vincristine type of chemo, and it really messed up my stomach. But there's a lot of things that happen, like why, you're either feeling really bad, your all your stats are down really low, and you get the chemo, and then sometimes you may be up in your blood work and doing really well with your white blood cell counts, red blood cell, hemoglobin count, the platelet counts, and it was just a constant battle with all of those being up and down depending on what day you're getting your chemo and what's happening, and whether you're going outpatient now and you're getting a little bit of a break, and you start building up a little bit again, everything gets a little bit better, but then comes another round of chemo, and you kind of just you go back down. So, but I'll be talking about everything. Also, the family support, friend support, um, all the help that I received, everything from not just family and friends, but some of the subjects of like who helps you at the hospital. And I don't mean the doctors uh, or the nurses, but they truly are, especially the nurses. I mean, not that the doctors aren't great. I'm not saying they're not, because their knowledge is what you know get you to the treatment, the recommendations, but the backbone of who takes care of you on a daily basis, hour by hour. I was extremely um, impressed with the whole nursing crew, even at Fountain Valley, that they're not really set up with treating, but the crews there, the nursing crews were great. And then, of course, at the UCI, which much longer care, you got to know them, and it was really, really good. So, but talking about your case manager that takes care of everything, getting stuff authorized for you, as far as with your medical coverage. which is such a headache. There's a whole nother binder, accordion binder, that my wife kept everything in, and it's huge. Every single bill by month, and confirming that what's been paid for and not. It's like, honestly, I don't know how anybody that has this horrible disease, without that doesn't have the support structure that I had and the help that I had, how do they get through it? I mean, your meds that you have to take. I've got 5 times a day, different hours, different meds, different amounts that sometimes on a weekly basis change depending on my blood work. So changing the pill box, changing the amount that you're taking, it was, uh, there were certain times at the beginning, I don't think I could have done it. I would have forgotten stuff and I just not remembered. So the help, um, of course, there's all types of help, wound care specialists, nurses, uh, the specific the pharmacist that is specific to transplant. So you're not just going to a pharmacy. There's specific specialty pharmacy person that works on your case. And for me, that was Gene at UCI, and the case managers, making sure that things are authorized. And we had a fairly good, we still do have a fairly good medical coverage. And it's really helped out a lot. And when I see how much this billing billed to the insurance, I, I I don't know how people get by without like good medical coverage. It's really kind of one of those things that now I think about quite a bit, because basically from July 5th to December 31st, uh, it was like $1.8 million for me billed to the insurance company. I didn't pay that, right? But I'm just saying. And from January 1, 2024 up until now, which is July 29th, it's already like 1.4. So, and I got obviously, 5 more months of this year. So I look at that and it's stuff you think about now. I mean, you don't think about it before, but um, so there'll be a lot of stuff I'll cover by date range and or category, that just kind of I want to go over. Also, my room behind me, usually all those meds, there used to be a ton more. It's reduced by about half of what I used to take, but there was like literally 60 different bottles of different meds. Also, this particular room in my house is the downstairs. There's like a second master where it's got a TV on the wall, of course, for me, a computer setup, a standalone bathroom, and the door was shut. For a while there, I was completely on lockdown. HEPA 14 filter system in the room, completely before I came home for the first time. Completely scrubbed clean. My wife had a cleaning service come in, so it's quite a big process. But things are looking good. The stem cell transplant went well. Uh, my bone marrow draws, they drill into your hip and pull out stuff, and they test it and they look for signs of leukemia. The last 3 bone marrow draws have done, uh, shows no leukemia. I'm in remission, and I'm going into the stage where I get a very light dose that I have to wear a bag. Its nickname is Blincyto, but it's a chemo. But I don't feel anything from it. There's nothing. Maybe tingly fingers and toes. That's it. I don't lose my hair, which, by the way, just started growing back not too long ago. And I actually got my first haircut yesterday in more than a year. So um, all the things. And to be honest with you, when I was bald, I didn't even care. My head's kind of got a normal shape to it, so it didn't look weird. And nothing better than getting up from sleeping and you don't even have bedhead. So the small things, right? The small things. so I'll start putting together timeline post and maybe or topic post, as far as videos about certain things, and kind of go from there. And uh, you know if people have questions, they can send inquiries. But just once again, I just want to stress, I'm not a doctor. This is just from my experience, and like all the doctors will tell you, if you have any kind of cancer or this specific cancer, ALL, acute lymphatic leukemia, blood cancer, everybody reacts differently. Their bodies react differently. They react differently, not to the disease, but to the treatments that you're going through. So it's I just wanted to do this. So we'll see how things go, and I'll probably try to keep the in between videos a little bit shorter. But this is more of a widespread kind of introduction, and I just wanted to kind of give the lay of the land and see how it does. Uh, it goes. And my video, as I get to learn a little bit more about the video editing and lighting and not such a grainy look to the video, and I'll work on stuff like that just so they're a little bit better. And also the audio and just you know learning all the ins and outs, because personally I've never had to use video editing. So all right, well, thank you for listening, and more to come.